Good evening. Thank you so much for watching PBS Fort Wayne and HealthLine tonight. I'm Mark Evans, your host. Tonight we'll be talking about diabetes across life stages. And we have a very special guest. She's been on our show a few times in the last few years. Emily Schroeder, a medical doctor as well as a PhD. You're an endocrinologist.
Yes.
Before we get started in the diabetes, what's an endocrinologist?
Yes, so endocrinologists are physicians who specialize in treatment of disorders caused by different hormones. So a main one is diabetes, but also thyroid disease, pituitary disease, adrenal disease, so a wide range of things.
Okay, well, we're so glad you're here tonight because November 15th, of course, the show is in November, but the 15th of November is World Diabetes Day, and it's sponsored by the World Health Organization. And the theme for 2025 is diabetes across life stages, as I mentioned before, and we'll get into that in just a moment. But just in case we have some viewers who don't realize what diabetes is, we'll get the summarization from you. But I do want to go ahead and plug that telephone number because we are an interactive television program. Of course, the number is on your screen, 866-969-2720. Please call that at any time if you have any questions whatsoever for yourself or somebody you care about diabetes. So what is diabetes?
Yeah, so diabetes is a condition in which there's either not enough insulin or the insulin in the body doesn't work well enough. And insulin is a hormone that's very important in terms of helping your body use the glucose and carbohydrates that you consume. So one type of diabetes is type 1 diabetes that usually is diagnosed in childhood, and it's an autoimmune condition in which the pancreas isn't able to make enough insulin. So folks with type 1 diabetes need to be on insulin lifelong. Type 2 diabetes is more a problem of insulin resistance, so the pancreas can make insulin, but for a variety of reasons it doesn't work as well as it should. So both of those can lead to elevated blood sugars. And then there's a third type, gestational diabetes, that can develop in pregnancy and usually resolves after the end of the pregnancy.
Yeah, the baby has diabetes or the mother does?
The mother,
okay.
Yes.
All right, thank you for breaking those down. And of course, what is the message of this particular theme this year, diabetes across life stages?
So really that diabetes, prediabetes, and the conditions that predispose to diabetes can develop at any point in life, and people at different stages in their life need different assistance and help, and diabetes impacts their life differently. So for example, a child with diabetes needs a different set of help and guidance than an adult or elderly person with diabetes.
Well, and how would you describe the differences between the children and the adults?
Yeah, so some of it has to do with diabetes prevention and some of it with treatment. So if you're thinking about diabetes prevention, to help prevent children from later on developing type 2 diabetes as they get older, you want to encourage them to be physically active, to eat healthy foods, support healthy foods in school, and just an environment that supports them being active and eating foods that are going to help them maintain their health lifelong.
I see. And then, of course, adults should know how to eat, but we all have fallacies. So if for instance, a patient has been diagnosed with diabetes type 2 in particular, what type of training would that person need? What kind of coaching would they need?
Yeah, so it's different for every person. So sometimes what folks need is more education about the types of food and activity that is healthy for them. But often we know what we probably ought to do, but it's difficult to make ourselves do that. So sometimes personal health coaches can be helpful, enlisting the support of your friends and family. So it's a lot easier to maintain some of these healthy habits if you have the support of those around you.
Yeah, that support is very important. Here comes the big one. Can you provide some stats? How many Americans are actually diabetic?
Yeah, so it's a huge number. In terms of adults with diabetes, it's about 38 million Americans with diabetes. That's kind of a hard number to wrap your head around.
Yes.
That's about 11% of the adult population in the U.S. has diabetes. And then another large proportion have prediabetes. And together it's about half of Americans have either diabetes or prediabetes.
Well, what determines if you have pre-diabetes. What is the fine line between pre-diabetes and diabetes?
Yeah, so there are different blood tests that can be used to diagnose whether you have diabetes or pre-diabetes. So in pre-diabetes, your blood sugars are a little bit elevated, but you haven't yet crossed that line into diabetes.
And for the adult onset, it is mainly diet and lack of exercise.
So it has to do with kind of lifestyle factors, diet, exercise, and there's also a genetic component
I was
as
going
well.
to ask.
Yeah.
Okay. My mother, type 2 diabetes. Is there a pretty good chance that I might have that or get it?
So there is increased risk if you have family members who have type 2 diabetes.
Okay. And I will say my family physician is keeping an eye on that.
Good.
And I'm not diabetic yet. Let's not have that happen. But I'm in good hands, I'm sure, if I do. We already talked about the 3 different types of diabetes. Which one would you classify as being probably the most serious or most severe?
So type 1 diabetes, because it's an autoimmune problem that kind of destroys the cells in the pancreas that make insulin. If you have type 1 diabetes, you need to be on lifelong insulin. So in that sense, it could be considered more severe. Type 2 diabetes, because it's also associated with being overweight, having excess body weight, tends to also be associated with things like elevated cholesterol, high blood pressure. So there's sort of a constellation of things that can develop together with type 2 diabetes.
Just recently, I was at a large gathering with a lot of friends, and these friends had children. And one of the children, I think probably 10 or 11, he had an insulin pump. Are those fairly common?
They are becoming more common, and they are becoming, I'd say, more technologically advanced as things go on, as time goes on. The other thing you might see are folks wearing continuous glucose monitors. So these are sensors that you can wear usually on your arm that have a little like plastic tubing that helps measure glucose levels every 5 minutes or so. And some of the insulin pumps can sort of talk through technology with the sensors and adjust how much insulin you're getting based on what your blood sugars.
That's fascinating.
Yep.
It really is. And it was only about this big, and he was wearing it on his belt. So I thought that was pretty cool.
Some of them have tubes, some of them don't have tubes, and I'd say they're getting smaller and smaller every year.
Yeah. And I was asking him some questions, and he says, well, it's just part of life, you know. And he certainly had hope that maybe he wouldn't have to wear that anymore down the road. So I'm hoping that for him as well. Let's talk about how, and we've kind of touched on this a little bit, but I'd like to get into it deeper, how diabetes can be prevented.
So type 1 diabetes, there's been sort of a different approach to that for type 2 diabetes. So we don't have a cure for type 1 diabetes or a way really to prevent it. For type 2 diabetes, there's a number of things folks can do in terms of, like we mentioned, lifestyle changes. So changing diet, becoming more physically active. There are classes you can take called the Diabetes Prevention Program, which sometimes can be covered by Medicare, that helps kind of coach people, provide that education, and then it's often a group class, so it provides you with folks that you can work with together to kind of help incorporate those changes.
You know, and that's something, because I've been doing this show for, 16, 17 years, and we've talked about diabetes even back then. And I am truly amazed with the technology advances and also the medical advances in diabetes. What kind of research is going on? I mean, are we adamant about trying to figure out if we can get a cure or not? What's happening?
Yeah, so there's a lot of research into new medications to help both to help with weight loss for folks with prediabetes, folks who might not yet have diabetes but have excess body weight. There's also been a lot of work into medications that can help in type 2 diabetes so that folks don't need to take insulin. So people are working on that. And then people are working on, for type 1 diabetes, are there ways to prevent that autoimmune condition and help preserve those cells in the pancreas?
You just hit on a point. I know a lot of diabetics, especially if they're afraid of needles. One of the, and you certainly know about this, about some of the patients you've had to coach into giving themselves injections, and some people have to give them injections because they just can't do it themselves. And I could tell that that's pretty arduous. And but we were talking back in the green room before the show that there's hope for getting around that. They're coming up with an inhalant of insulin.
So there is an inhaled insulin. It's not used a ton because there are specific requirements for folks who might be good candidates for it. So for now, mostly what we have are insulin, sometimes in insulin pumps. There also are kind of insulin patches that sit on the skin and can deliver insulin.
Oh, that's
so
neat.
there are different insulin delivery mechanisms.
Yeah.
We're still working on that as well.
How are those patches working? That sounds like a great idea.
So it's sort of like an insulin pump, but without kind of the different settings and programs. So they kind of they're different versions. Some continuously deliver a small amount of insulin, and others, when you press a button, then it gives you a larger amount.
I see. And it's kind of a time-released thing?
But yeah.
Oh, I see. Very good. Oh, I'm so sorry. We've got a phone call, and of course those phone calls do take priority. By the way, if you have a question, please call that number on your screen, 866-969-2720. We're talking to Dr. Emily Schroeder, who is an endocrinologist and a specialist when it comes to diabetes. So please have those phone calls coming in, just as James has. And James is asking, I'm going to look over here at this particular screen, can you explain pre-diabetes? Can it be reversed? And the reversal is a very good question.
Yeah, so that is an excellent question. So prediabetes is when patients start to have slightly higher blood sugars, but they're not yet high enough that we would consider it to be diabetes. And usually that is due to increasing insulin resistance, we would say. So the pancreas makes insulin, but the cells in the body, in the muscle, and the liver don't respond as well to the insulin. There are ways to reverse prediabetes. So one important thing is to try to prevent developing diabetes. So if you have prediabetes, you're at increased risk of developing diabetes. So a lot of effort is put to try to prevent development of diabetes. But you can also potentially reverse prediabetes and get back to normal blood sugars. And usually that has to do with making diet changes, increasing physical activity if you're able to do that. And sometimes some medications can help as well to help with weight loss, help improve that glucose metabolism.
Okay.
Yeah.
And I'm going to use myself as a testament, or testimony, I should say, when it comes to this. I went to my physician, as I do every year, and 2 years ago, he says, you're just this close to being pre-diabetic. Excuse me, and at that time, I was about 25 pounds heavier. In the process, in the last 2 years, I've lost that 25 pounds, and I've got a little more to go, I will admit, but I'm out of that danger zone, and it just took a matter of losing some weight.
Yeah.
And of course, dietary changes as well.
Yeah.
So, yeah, and doctor was very proud of me, I will say. Don't you find gratification in that when people take your advice and they turn their lives around? Isn't that great?
Yes.
Yeah, okay. Let's talk about in fact, we're going to talk about the dietary needs and changes. The dietary changes that would make a diabetic patient need to undergo to get the blood sugar in the back to the level where it needs to be, and also in that weight range. And I would imagine that would be fairly simple. It's a matter of eating sensibly, right?
It is, and I would say different diets work better for different people. So what you really want is something that's going to be sustainable for you. Both to often, if folks need to lose weight, to decrease the calories that they're eating, but also to make sure that they're eating less processed food, more kind of whole foods. If they're able to decrease the amount of carbohydrates they're eating, especially those processed sweets and so forth, can be helpful as well.
What about alcohol?
So alcohol we often think of as sort of empty calories. So I would say in moderation.
Yeah, there's a lot of alcohols that don't have carbohydrates, but they do have calories.
Yes.
Yeah, everything in moderation. I kept hearing that too as I was preached to by my family physician. Everything in moderation, Mark. Okay. We have more calls coming in. I love seeing those. Tom is asking, what exactly makes a person insulin resistant?
Yes. So that's a good question.
Good one.
It can be caused by a number of different things, or most commonly an interaction of a lot of different things. So one of those would be being overweight, having excess body weight. That will increase insulin resistance. There's certain medications that people take that also will increase insulin resistance. So for example, steroids like prednisone, but there are also other medications that can increase your insulin resistance. And then we know there's also a genetic component to it as well.
Yeah, and I wanted to ask you about that too when we were talking about some of the causes of diabetes, and it can be handed down to you. As I mentioned earlier in the show about the type 2 with my mother developing, she wasn't born with it. But if you have a parent who is actually what would that be, type 1, is there a good chance that you could be type 1? Would you know that eventually, or would you know it soon, early in your life?
Yeah, so there is both a genetic predisposition to type 1 diabetes and type 2 diabetes, different genes, and we don't fully understand the interaction of all of those. But you would be at increased risk. And type 1 diabetes, even though we think of it as a childhood onset diabetes, actually can develop at any age. So it's not uncommon or unheard of for adults to develop type 1 diabetes as well.
Okay, very good. Another call coming in, and it's Lenny. Lenny is asking, I have heard cinnamon is effective at curbing diabetes. Is that true?
So there are a lot of supplements out there. Cinnamon is kind of more a spice than a supplement that talk about their ability to decrease insulin resistance. Those things don't have as much data or studies behind them as medication, so it's hard to kind of recommend that one way or the other.
Yeah, I would imagine. I guess it's worth a try. Anything in moderation.
Yes.
There we go. All right. We're still taking your phone calls. We still have approximately 10 minutes left in the program, so please call the number on your screen talking about diabetes. And of course, as I mentioned earlier at the top of the show, November 15th is World Diabetes Day, sponsored by the World Health Organization. The theme for this year is diabetes across life stages. So the underlying message here is once you have diabetes, there's a good chance you're going to have this the rest of your life. So we need to be able to deal with that, number one. Number two, how to treat it and try to get those levels back to normal.
Yes. Yep.
And to see your doctor on a regular basis. Yeah, all those things come into play. What are the symptoms of diabetes?
So sometimes there can be no symptoms, so that's why it's important to make sure that you're checking in regularly with your family doctor. Signs and symptoms of very high blood sugars, people can get very thirsty, and you tend to pee out a lot of glucose in your urine. So people think of just peeing frequently, and then as a result being very thirsty is something people will notice. Blurry vision can be another thing. Feeling weak can be another thing. But often with type 2 diabetes, there really aren't any symptoms, and that's why it's important, like I said, to see your family doctor regularly, make sure you're getting any recommended blood tests.
Are there any implications as far as mental, how do I phrase that? Does diabetes have anything to do with your disposition, your moods, and things of that nature?
So it can. So people will notice mood changes if their blood sugars are very high or very low. So if you're on medication for diabetes that makes your blood sugars low, people often get confused, can even lose consciousness if their blood sugars are low enough. And also when blood sugars are high, people also don't feel well.
Yeah, okay. The other question I had, you might have diabetes, you don't know, you're going to go to the doctor. How is it going to be diagnosed?
So it's diagnosed through a blood test. There are actually a few different tests that can be used kind of depending on the circumstance, but through one of those blood tests.
And that's usually blood drawn? Oh, I see. Okay. Where should one start? And people are probably saying, yelling this answer as they're watching, but it's very important. But where should one start if they believe they have those symptoms of diabetes and they want to see if they have it or not?
Yeah, so I would recommend starting with your family doctor. And they can talk to you about what symptoms you have, what risk factors you might have for diabetes, and then determine what testing would be appropriate for you.
And do you have to be necessarily referred to a specialist? Not
necessarily. So most folks with type 2 diabetes do not need to or do not end up seeing an endocrinologist. Usually the family doctors can manage.
But type 1 is a different story?
Type 1, most folks with type 1, we do have see endocrinologists. They'll be on insulin, sometimes insulin pumps, so it can be a little bit more complicated.
I see. And what about the ladies who have the gestational diabetes. How is that treated during their pregnancy?
Yeah, so sometimes that can be treated with diet changes alone, sometimes with oral medications, and sometimes with insulin.
Okay.
Yeah, and that's usually, will be diagnosed by your OB or family doctor during pregnancy, and sometimes people will see maternal fetal medicine as well.
The next thing I want to ask you, in fact, our caller Kathy has a question regarding this. I'll let that question take precedence before I ask you this, but I want to get into the effects of diabetes to the body and possibly to the brain if you don't have it treated. But Kathy is asking, can type 2 cause skin problems like ulcers?
It can. So diabetes can cause a number of different conditions. Some of those affect small blood vessels, so that can, and nerves, so you can develop neuropathy where you're not able to feel well at the bottom of your feet. You can develop retinopathy, so damage to the eyes. And so folks can also get what we call peripheral vascular disease, so poor circulation to the legs. And so that combination of poor circulation to the legs and then also the neuropathy, not being able to feel the bottom of the feet as well, can definitely predispose folks to foot ulcers, other kind of ulcers. And then diabetes also can sometimes impair wound healing. So once you get the ulcer, it can be hard to treat.
And it can also be hard on organs, can't
yes.
it? Other
Yep.
organs?
Yep. So the
Explain
heart increases risk of coronary artery disease, so heart disease, and also increases risk of stroke.
Oh, wow. Oh, my. Yeah, we're talking serious stuff here. How many people you think walk around? We talked about the percentage, about 10% of Americans having diabetes, but how many of that percentage know they have diabetes?
Yeah, so the 10% are folks who've been diagnosed with diabetes, and then there's another group of folks who have not had testing, don't see a doctor regularly, and so don't know that they have diabetes.
So the people who don't really know they have diabetes, but probably do, what are their reasons for not having those symptoms checked out?
So there can be a number of reasons. Like I mentioned, some people don't have any symptoms, so they're not aware that they need to get any testing.
True.
Other folks don't have a family doctor. That can be for a variety of reasons. Sometimes that can be due to not having a lot of family doctors near where you live, difficulty getting to the doctor, difficulty having health insurance, or being affordable to go to the doctor. So there can be a variety of reasons.
Can diabetes be fatal?
It can. So both if blood sugars get very high or very low, but then also due to those other kind of complications to the other organs that can also be quite serious.
Yeah. So we know that there are treatment options as well as ways to prevent diabetes, but do we see a cure on the horizon?
So a lot of people are doing a lot of research into diabetes and sort of approaching the cure from different aspects. So I think really it's going to have to be multifactorial, both addressing the issue of preventing type 1 diabetes and then also how to prevent and cure type 2 diabetes. I will say we've made a lot of progress, especially on treatments for type 2 diabetes and then technology like insulin pumps and so forth.
Yeah, we've talked about the insulin pumps, the patches, the insulin injections. Wasn't there at one time a pill that you could take, like an insulin pill?
So not an insulin pill, but there are other oral medications for type 2 diabetes that can be quite helpful. And there are also some injectable medicines for type 2 diabetes that are not insulin. So those are other options. So we really have a lot more treatment and also prevention options than we used to have.
And I would imagine that because we're all individuals, everybody has their own case. No two people are alike.
Exactly. Yep.
Yeah, okay. We have a couple more minutes left in the program, and I wanted to ask you if somebody had some questions and before they even called their doctor to check out symptoms and also learn more about diabetes, what is the best source for that right off the top of your head?
Yeah, so there's a number of great resources. The World Health Organization has some great information.
Also known as WHO.
WHO. The Centers for Disease Control also has a lot of statistics and information about diabetes. And the American Diabetes Association also has a lot of information on their websites.
And of course, your family doctor and people like you are well versed on that as well. And so with the last minute or so in our program, where I guess the question would be, what would you like to tell our viewers as maybe some what I call take-home points about diabetes in general?
Yeah, so and we've talked about kind of the three main types of diabetes. We've talked about the fact that sometimes folks might not have any symptoms, or you could have symptoms from diabetes. So important to be seeing your family doctor regularly to get checked out both for diabetes and for other things. And then just to be aware that there are a number of things we can do if folks have prediabetes to help try to prevent development of diabetes, and then different treatment options for diabetes as well.
Yeah, very good. Well, you've been very informative. We thank you for coming on the program tonight. And we thank you for watching and for all the questions we had as well. Of course, we're here every Tuesday night at 7:30 for HealthLine on PBS Fort Wayne. We thank you very much for your phone calls and your viewership, and of course your support for the station. Until next time, good night and good health.
PBS Fort Wayne was made possible in part by
momentum, progress, innovation. Parkview Health knows standing still isn't an option. We must learn, grow, excel, and actively work to advance healthcare for our community and beyond. With technologies that improve access to care and teams of specialized providers, we are moving healthcare forward. Right here at Parkview Health.